Throw our handle in the way.
It's all part of the shop.
How long have you been with Feedback?
19. I've been
Were you with Como before that?
11. I was with 11 until they closed the newsroom
Okay.
in 1999, I think.
That's right. I remember Channel 11.
I do too.
We'll start with your name and spelling.
Sure. So Kristen Fox,
Spell.
KristenFox,
And your title.
Chief Human Resources Officer,
For.
Swedish Health Services.
Okay. How is working in a hospital stressful?
People choose careers in healthcare because they want to care for other people during very vulnerable times of their life. And so that's very rewarding, but it can also be very stressful because you're dealing with a patient during that vulnerable time as well as their family, as well as working as part of a care team and having multiple patients with multiple needs. So it creates an extra level of stress.
Do you think people here need and get the mental health breaks that they need?
I think that people do need mental health breaks. I think the challenge is that I may need one during a moment where my patient needs me. And so trying to balance the needs of our patients and the needs of ourselves is an ongoing challenge of healthcare workers.
How has the outlook on positive mental health changed in your industry over the years?
I think one of the really important components of that conversation is that we've talked about caring for the whole person versus just the diagnosis or the reason why they're visiting us. So that's their spiritual well-being, their whole health well-being, their family well-being, kind of their community needs and support. And I think that's helped in the mental health conversation.
How does Swedish prioritize mental health?
One of the big ways that we prioritize mental health for our caregivers is through offering a caregiver assistance program that's available to all of our caregivers as well as their families so that they have the mental health support that they need for them and their families. And it's available 24 hours a day, 7 days a week. And it's for counseling, it's for debriefing after a critical incident, and it also helps them with relationship support, both professional and personal support.
How does it stand out?
It stands out in the fact that this program is available for everyone, including whoever is in the household. This program also oversees a reduced or free insurance plan for our caregivers who are benefits eligible based off of their income and the size of their family, and that's special. I haven't experienced that level of support in any other organization where I've worked.
How does what are some of the programs that are helpful?
So in addition to the caregiver assistance program, we have something that I think is really kind of neat and personalized for our caregivers. And we have, as part of our health incentive program, a wellness focus. And it's not the traditional wellness focus of health insurance plans, it's whole person focus. And so there's information on financial wellness, spiritual wellness, caring for myself during kind of the influenza season. And these programs are throughout the year. So not only am I getting education, I also have the opportunity to create a personal commitment that makes it special for me. And also there's a lot of resources available that I can kind of pick and choose what's most important for me as a caregiver.
Are there any new programs this year or in 2018 coming up?
Yes, for 2018, one of the things that we are adding for our medical plan is mental health, behavioral health coverage with no limit on visits, and it's covered 100%. Because we see behavioral health visits the same as an annual exam as part of keeping our employees healthy.
And why is that important for Swedish?
It's important for our caregivers to be healthy because they're the ones who are engaging in the care of those patients and their families. And so one of our most critical things is caring for our caregivers so they can provide that high level of patient care experience.
Talk about any specific program that comes to mind about the mental health stuff.
In addition to the caregiver assistance program, what we're doing with the benefits program, what we also are doing as a leadership team is truly committing to helping the caregivers remember the why behind their decisions to choose a career in healthcare. And why that's important is people very intentionally choose to go into the healthcare field to be in service of others during these vulnerable times. And so the more that we can be intentional about connecting them to that why, the more that it brings them joy of practice, which helps them with their mental health. So for us, that's one of the most critical things we can do as a leadership team, is reconnect our caregivers to the why.
Is there a certain time limit of the caregivers being exposed to their jobs where this need is given, meaning does it take 5 years for a caregiver to say, hey, I think I need some help, or does it take longer than that?
I think it depends on the individual, and sometimes the help that I need isn't even for me personally, it's for my family. And so that's why we want to make sure that the resources are available when people need it, no matter what time of day or how long they've been with us, that they have access to the help as they need it. Because again, as a caregiver, I'm not only caring for my patients, I'm often caring for the members of my family who need extra support and help. And so we just don't know when someone is going to need it. And so it's available to have access all the time.
Anything else?
Why don't we redo the beginning of the leadership piece?
Okay.
You kind of fumbled a little bit on that.
Sure.
I think that's a really important message that Michelle might think.
I'm still going. Go
Okay.
ahead.
One of the critical components for the leadership team, I'm going to do it again, sorry.
Right.
One of the critical components of the leadership team at Swedish is to reconnect our caregivers with the why behind their decision to choose a career in healthcare. Caregivers very intentionally choose to go into healthcare fields, and they do that to be in service of others during those vulnerable times. But that work can also be emotionally and physically draining for people. So the more that we can reconnect them with the joy of practice and the why behind that decision, the more that it helps with their mental health and their resiliency in the workplace.
And that has a domino effect of helping your patients then.
Correct. When our caregivers are feeling engaged to the joy of practice, they're connecting with the patients in that high-level care that we provide at Swedish.
Anything else I should ask?
Do we touch on, do we want to talk about I think that's, the Wellbeing Trust is a really cool system-wide mental health, but
I think
I
we,
think that's too
yeah.
broad.
Let me just take a quick peek, but I think
Yeah.
we
Cover
have
most
it.
of the bases,
Yeah, I think we have it.
Very good. We'll call it quits then.